All right, just like to welcome everyone today to the webinar, and just to let you know that we will begin promptly at 3 o'clock. All right, welcome everyone from the Children's Safety Network. For your information, this webinar is being recorded, and it is called Child Safety Learning Collaborative, Building Sustainable Impact, and it's sponsored by the Children's Safety Network. So the Children's Safety Network is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services under the Child and Adolescent Injury and Violence Prevention Resource Centers Cooperative Agreement for $5 million with 0% financed with non-governmental sources. This information or content and conclusions are those of the author and should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government.
Hi, welcome everyone to our webinar today. I want to just pass along a few technical tips. So please note that your audio is via your computer, and the quality will depend on your internet connection. So if your audio is choppy, find a more stable internet connection, or you can listen over the phone by dialing one of the phone numbers found in your Zoom invitation. Furthermore, all of our participants today are muted. You can submit questions throughout the event using the Q&A button found at the bottom of your screen, and we will be addressing those towards the end of the event. There's also an option to turn on captions, clicking the caption button found at the bottom of your screen. Sometimes it's located in the More icon, the three dots, if you don't see the word caption there. We are going to be sharing all of our resources, including a recording and the slides, within the next 2 weeks, posted on our website for all of you. And please note that it is a policy of Children's Safety Network and the Education Development Center that no AI note takers or bots are allowed to attend. If they are here, we will have to remove them. Thank you, and I'll hand this back to you, Beth.
Thank you. Well, my name is Beth Ostrich. I work for the North Dakota Department of Health and Human Services. I am the Injury Prevention Program Director and the Maternal and Child Health Lead for the Family Health and Wellness Unit. I have almost 20 years of injury prevention experience. I am also one of the many great members of the Children's Safety Now Alliance. So please help me in welcoming our presenters today. We have Jenny Stern-Carasone, Associate Director at the Children's Safety Network, has over 20 years of experience as a prevention professional, designing and providing technical assistance to state agencies, tribal governments, community-based organizations, schools, and juvenile justice departments to improve prevention strategies and service delivery by customizing approaches to address clientele's unique needs. Jenny builds the capacity of states and jurisdictions to use data and evidence-based strategies to reduce injury-related deaths, hospitalizations, and emergency room visits. She leads a team implementing quality improvement approaches to improve child safety through rapid cycle tests of change and spreading evidence-based practices. She is the topic lead for child passenger safety and teen driver safety in the Child Safety Learning Collaborative. Lauren Gilman is Senior Training and Technical Assistance Associate, is a highly skilled technical assistance specialist and an experienced program manager with extensive knowledge of mental health promotion, behavioral health, school-based initiatives, substance misuse prevention, youth violence prevention, and mentoring. Drawing on her health communications and capacity building expertise, she helps community organizations and school districts bridge research and practice, implement and sustain evidence-based programs, strengthen cross-sector collaboration, and use data-driven planning to achieve system change. Lauren is the content specialist for bullying prevention for Child Safety Learning Collaborative. Her integrated approach to advancing substance misuse prevention and SEL emphasizes interconnected risk and protective factors and fosters collaboration at the community level. Claire Grace Jones, Senior Training and Technical Assistant Associate, is a public health and safety expert specializing in capacity building, instructional design, training, quality improvement, project support, and virtual engagement. A community prevention specialist, she has 20 years of experience promoting public health with a focus on substance misuse prevention and the Strategic Prevention Framework. Jones advances health, behavioral health, safety, and injury and violence prevention initiatives through her roles with the Children's Safety Network as the Sudden Unexpected Infant Death Prevention Topic Lead of the Child Safety Learning Collaborative. Maria Catardis, Senior Training and Technical Assistance Associate, is an education and public health researcher with expertise in youth development, adult learning, international education, and quality improvement. She is a content specialist for suicide and self-harm prevention and poisoning prevention. She manages and analyzes data, provides training and technical assistance, and presents on topics such as quality improvement and evidence-based and evidence-informed strategies for the child and adolescent injury and violence prevention. She utilizes both qualitative and quantitative research methods to help states develop a clearer picture of where they are in their quality improvement process. Now, as we get started today, just a reminder that you can enter your questions into the Q&A throughout this webinar, and we'll answer questions at the end. Next to present is Lauren.
Hi, everyone. Can you hear me okay? I hope so. This is Lauren Gilman. As Beth just said, I'm one of the CSLC staff. I'm also the topic lead for bullying prevention, and I'm really happy to be here with all of you today. First of all, I just wanted to quickly go over today's agenda. I'm going to do a quick introduction to the CSLC, and then I'll turn it over to Jenny, who's going to be talking about our framework for quality improvement and innovation, which is a really key part of our initiative. After that, another colleague is going to talk about sustainability and specifically what we mean, which is beyond just getting more money for the next program and really about how you can sustain things in a way that is more structural and integrates. Then we'll get a few great examples from the field and then a forecast about our next cohort. So if you could go to the next slide, please. So this is just a little placeholder. We're talking about the Child Safety Learning Collaborative, or the CSLC. So we can go to the next slide. So as you can see here, the CSN, or the Children's Safety Network, has a number of different components. We host the Children's Safety Now Alliance, or CSNA, which is a national partnership of experts across the field of child safety. And they get together and advise the CSN on topics of focus, talk about tools, talk about priorities. And that's a really important part of what we do. We offer training and technical assistance to just about anybody who needs it in this field. We have webinars such as this one and lots of great published resources available on our website. And what we're talking about today is the Child Safety Learning Collaborative. So why don't you go to the next slide, please? Thank you. So the vision of our collaborative, really we're here to activate or actuate CSN's mission by providing targeted technical assistance to Title V agencies and to their partners in order to effectively advance injury prevention strategies and reduce child and adolescent injuries, hospitalizations, and fatalities nationwide. Next slide, please. So what we do is the Learning Collaborative over our 5-year funding period consists of 3 cohorts. Each one is about a year and a half. And right now we're in the middle of cohort 2, kind of just about in the middle, about 2/3 of the way through. So the application period will reopen in just about a month. And that way, any new states or jurisdictions who want to be part of this can apply to participate. In addition, states that are currently participating, we encourage them to stay on for the next cohort to really keep working on what they've been doing, keep receiving the support from us and the peer support from others across the country. And also, um, we encourage states to pick up another topic for a successive cohort if it feels like a good fit. For example, one of my states that's doing bullying prevention, one of the partners on the team, also works with suicide prevention at the state level. So I'm in conversation with them about maybe they also want to be part of the uh, suicide self-harm prevention topic, because it would be possible to participate in more than one topic. So next slide, please. So these are the 4 topics we have going right now. As I said, I'm the topic lead for bullying prevention. Jenny is the lead for motor vehicle traffic safety, which includes both child passenger safety and teen driving safety. We also have suicide self-harm prevention and sudden unexpected infant death prevention as our 4 topics for right now. Next slide, please. And as you can see, we're all over the country. So if you look, we've got states participating north and south, all different time zones. We've got larger populations, more rural. We've got smaller states. We also have the Northern Mariana Islands. I'm very lucky to have them as part of the bullying prevention cohort. That means that what we try to do is adjust the time zone for our calls to make sure that everybody's able to participate. But it's really nice to have the representation of the whole all across the country because you get so many different perspectives when we have calls or webinars or any of the events that we do together. So next slide, please. So these are the features of our learning collaborative. It really is a collaborative. And I don't think anybody said this yet, but you'll probably hear it again. Our philosophy is all teach, all learn. So really everyone who's in this collaborative is an active participant. Everyone has something to contribute as well as something to gain from all the discussions that we have. We really want to be learning from each other. We are a resource for evidence-based strategies. So we have a change package, which we have for each of the topics, which is really filled to the brim with evidence-based change ideas and strategies. We really want to make sure that what we're encouraging people to do has an evidence base behind it. To support states to create and use a structured improvement process. We'll be talking about this more in a bit, but basically we want to make sure that everybody who participates has the tools to go through a quality improvement process that meets their needs, whatever those may be. We have targeted technical assistance. That's basically we provide TA when it's needed. Personally, I like to meet individually with states in my topic cohort every month or 2 if I can, just to check in on progress, and then more frequently if they really, could benefit from more support, from guidance, sometimes just from an outside perspective, because people are working with partners within their own state and they don't get the sounding board of having an outside person who's worked with lots of states and lots of communities and can kind of bring that perspective in. I also can make all of us as a TA team and the co-managers here make connections with expert resources and experts all the time. So we're contributing to a common national agenda for child safety. It's something that we all can agree on. And to demonstrate change over 5 years. So we're looking for all the participating states and jurisdictions to make progress so that we can then document and demonstrate change in aggregate related to each topic over the 5-year period of this initiative. So I think that's a kind of a good summary of what we're doing. If you have any questions, please feel free to enter them in the Q&A. And now I'm going to turn it over to Jenny for our next section.
Thank you so much, Lauren. And just one other clarification in regards to the definition and scope of the CSLC is to clarify again that our target population is that we're working with Title V agencies and representatives. And if you aren't a Title V agency or representative, it's fine to be interested in the CSLC and to explore joining the CSLC, but you need to partner with your Title V agency, generally your public health department, maternal and child health, or injury and violence prevention, and build in your strategies to a statewide goal or initiative. And you can always reach out for questions more about that. I want to talk a little bit about the CSN Framework, which is at the heart of our work. Next slide, please. Throughout the CSLC, Children's Safety Network has had the opportunity to develop and test our CSN Framework for quality improvement and innovation in child safety. The framework draws on elements from the CDC social ecological model, from the Foundation Strategy Group's collective impact approach, and from the Institute of Healthcare Improvement Breakthrough Series, as well as the Associates in Process Improvements Model for Improvement. And then we've taken all of those elements and wrapped them into this framework we've created that we've now been implementing and testing throughout the course of the CSLC through multiple cohorts. The focus of the framework is to support, is to support states to make improvements and innovations in their child safety system, as well as develop their child safety workforce, which we then believe will lead to positive health impact in the populations that we serve. The framework enables states to effectively use data in order to understand the target population and identify which areas they want to focus on, and to build public will and state jurisdiction capacity in key areas that are essential to achieving sustainable and scalable child safety results. We do this through targeting the following core tenets that you see over on the right, circled in blue. The identification and use of data-driven, evidence-based, and evidence-informed strategies, programs that enhance child safety expertise, the increased effectiveness of management and leadership, and systems improvement through ongoing commitment to shared learning and principles drawn from advances in improvement and implementation sciences. Next. So building off the framework, as I said, we know that these three cornerstones are essential to success: the child safety expertise, management and leadership, and systems improvement. And you'll hear about this throughout the rest of today. You heard that we offer resources and support through technical assistance, and we address all three of these areas. Our technical assistance is tailored to the needs presented by each individual state strategy team, as well as our comprehensive topic teams, which are comprised of the state strategy teams, and across the Learning Collaborative as a whole. This can mean that we're designing webinars to meet emerging needs with experts coming in from the field, presenting innovative approaches, new research, or emerging practices. It also can mean that we're designing tools in order to assist states to develop and sustain effective partnerships, or we're providing training and tools that help Title V agencies establish an improvement portfolio that integrates overarching state objectives and builds a culture of change. Next slide, please. You heard that one approach that's central to the CSN framework is the model for improvement. This is a tool that accelerates organizational improvement. It centers on clarifying the aim, or what is it that we're trying to accomplish. Then the next step is determining what changes you think will result in an improvement, and decide the data that you're going to collect and analyze in order to know that the change is actually an improvement and not just a change in circumstances. This idea of an aim, identifying changes in order to gain an improvement, and how will you know that you've gotten that improvement, is really the crux of the work that we do in the CSLC. As you heard Lauren mention, we have created change packages for each of our key injury topics that provide change ideas with evidence-based programs and strategies, as well as measures to enable you to determine if you're reaching the improvement that you're seeking to gain. Then we use Plan, Do, Study, Act cycles as a primary tool in order to conduct small tests to effectively try new child safety approaches and interventions throughout the system, and then adapt them in order to ensure that they are working before implementing them system-wide. The entire idea is to start small to go big, so that you really are able to focus in and gain the most impact for the least amount of work. Next slide. The primary goal of the collaborative, as you heard, is to reduce fatal and serious injuries amongst infants, children, and youth ages 0 to 19 by supporting collaborative improvement among state and jurisdictional level Title V agencies that are working to address child safety. Within each of our injury topic areas, the focus of the work is to, 1, identify areas ripe for improvement, and then to support states and jurisdictions in developing a knowledge management system in order to support innovation and sustainability, to help them to use real-time data to inform decision-making and rapid improvements. And ultimately, we're looking to enable states and jurisdictions to implement and spread evidence-driven strategies and programs in order to reduce childhood deaths and injuries. We use evidence-driven strategies and programs that are aligned with the injury-related maternal and child health national performance measures and also meet the following criteria of having the potential to close a significant gap between current prevailing practice and the best scientific knowledge in injury and violence prevention, that they also show strong potential to contribute to the reduction of injury deaths, hospitalizations, and emergency department visits among infants, children, and adolescents, and that they have demonstrated feasibility and potential for breakthrough improvement by at least some states and jurisdictions. So we utilized our experience in these successive cohorts of the CSLC to continuously improve our change packages and the approach that we're using in order to ensure that we're really providing the best support and enabling states to succeed. Next slide. So the quality improvement process requires that first states, when they come on, really have a clear idea of what it is that they're working on, and then identify who's going to be on their team, members, roles, responsibilities, and set up a routine meeting schedule. In the CSLC, as I mentioned, we refer to this as the state strategy team, and then state strategy teams come together and comprise topic teams. Each state strategy team then sets an overarching aim using SMART language with outcome level data. For example, by December 2028, we will reduce teen-related fatalities, injuries, and ED visits in our state by teen driver-related fatalities, injuries, and ED visits in our state by 3%. Then after that, the team selects evidence-based strategies referred to as change ideas in the CSLC and measures that and identify the data sources so that they can begin to move forward in developing a strategy. They use the change ideas and set SMART goals, such as by May 2027, we will increase the number of schools implementing an evidence-based teen driver safety program from 3 to 15, and use quality improvement tools such as 90-day aims and PDSA cycles so that they can test and change ideas and determine the best course of action in order to achieve their goal. It is through the consistent review of data that enables teams to make micro adjustments that are necessary in order to successfully reach their goal. With each success, the team then has an opportunity to revisit their change ideas and enhance or expand their strategic focus. And we are there alongside for the whole ride, providing the support and the technical assistance to help them get there. I now want to hand it over to Claire Grace to talk a little bit more about the concept of sustainability in this work.
Great, thanks, Jenny. So we are now going to talk about how all of this builds sustainable impact. And as we go to the next slide, or maybe we don't, sorry, Maria is going to bring up, thank you, Mentimeter that we are going to use. If you're not familiar with Mentimeter, you can either scan this QR code, or someone in just a moment is going to put a link in the chat that you can use. And would love you, the prompt for this is, what do you think of when you hear the word sustainability? So when you hear the sustainability, what comes to mind? And I see we've got a few people responding already. All right, so it looks like we've had about 20 people respond, and you can see that folks are converging on some of these terms. Long term is definitely coming up. We've got folks that are talking about things like institutionalizing change, things that happen over time, community partnerships. That it's about people and funding. It needs to be reasonable. It's about partnerships. This is great. And if you have any, so if I'm going to give just one more minute for folks to keep responding, so we've got a few people just ticking in. I see resilient, vision, Great. All right. Well, we're gonna we can take down the Menti now, and then we can click to the next slide. Awesome. Thank you. So Jenny just spent some time talking with you about the CSN framework for quality improvement and innovation. And the reason that I have it here again is because when we think of sustainability, we're thinking about not only about sustaining outcomes, but also about sustaining evidence-based processes. We had one state that was a member of a previous cohort, the last cohort of the CSLC, and they actually wrote it into their planning that participating in the CSLC and building their capacity and the capacity of their partners that they worked with through the CSLC to implement the CSN framework for quality improvement, that was part of their sustainability planning. Because when you're thinking about sustainability planning, really the idea is if a particular person or if a particular funding source went away, how would you be able to sustain the outcomes that you know are working? So I also want to mention that when we take a look at state action plans, we all often see that participating in the CSLC has been written into those plans as part of thinking about and planning for sustainability. We can go to the next slide. So sustainability really ensures that improved processes, again, last within an organization or within a system. It provides that they're required for long-term maintenance, improvement, and spread of strategies. So as you are doing that sustainability planning, you're really thinking about where this is going long-term and how you are going to keep sustaining that work. I find it interesting when I've worked with folks in community prevention or in injury prevention, and they talk about passing some kind of like policy or changing something around injury prevention. They folks sometimes will say, "Oh, great, we passed a policy, though, so this now is just gonna keep going by itself. We don't have to put any funding or any people power into it." But we know a policy is only as good as whether it is being monitored, whether it's being enforced, whether it is being communicated. And so having a plan as you are looking at what strategies are effective for what you want to improve and what you want to accomplish, you want to be thinking of sustainability right from the beginning. And it demonstrates endurance of programs despite potential disruptions, which again, when we talk about programs here, what we're talking about are programs that are implementing evidence-based practices, policies, things that we know work, things that people have used data to identify and that have been determined to be a good fit for the community that they're working in. You can go to the next slide, please. As I said, sustainability is not kind of a one-off. It's not a one-size-fits-all. It's not a temporary solution. It's not based on preserving one person or one specific program. It's really about looking at how you can sustain the processes and the outcomes that you are achieving. Next slide. So there are a lot of ways that we support folks to do this through the CSLC. When it comes to, think about those circles that we looked at. When it comes to child safety experience, we give people the opportunity to engage with experts who can share evidence on strategies that go across injury prevention topics or for topic-specific things. We provide resources such as our change packages that have been mentioned, and we increase knowledges across priority and emerging child safety topics. Also, when you're part of the CSLC, the support that you get helps build practitioner capacity to lead teams, manage resources, create, leverage, sustain effective partnerships and collaboration. These things that we're talking about how do you, sustain a program or sustain a policy or sustain something to be effective, we can help provide some of the tools and some of the outlines for that, such as creating memorandums of understanding, creating agreements, looking at how you can move partnerships from levels where you're just kind of having some communication to where they might be real collaboration and coordination. And then looking overall at systems improvement, building practitioner capacity to develop and implement injury and violence prevention systems using this quality improvement framework, using implementation science and using tools such as data maps, 90-day aim statements, PDSAs, implementation checklists to ensure widespread sustainable implementation of evidence-based strategies. You can go to the next slide. When we look at workforce development, we offer things like webinars, state technical assistance webinars. We have topics with our specific teams. We also often offer additional opportunities for individual and group assistance. So maybe something like topic hours where we're continuing to bring peers together to share successes, to share challenges, to maybe come together around a topic that's of specific interest to that group. We also offer, as Lauren was talking about, individual technical assistance. So it's really an opportunity for us to meet with a specific state, meet with a couple states that are working on something similar, and see how we can support them, what kind of tools we can offer, how we can help them think through things. We provide support for strategic and systems thinking and quality improvement around SMART aims, goals, putting together plan, do, study, act. I realize that we have this acronym that maybe not everyone is familiar with and kind of rolls off the tongue around here. But really thinking about what are kind of these small things that you can change and test, and if they're effective, how can you continue to utilize those and to spread them to be successful. And then child safety systems development. Again, we're talking about support and tools for systems thinking and mapping, partnership analysis, and tools like memorandums of understanding and partnership agreements. So you can go to the next slide. And I am now going to hand it off to Maria.
Thanks so much, Claire Grace. And thanks for joining us, everyone. I have the privilege of sharing some examples from the field that really exemplify a lot of what we're talking about today. So in the CSLC, we participate in quality improvement while we're teaching and supporting all of you and our states in quality improvement. So one of the things that we've been doing is following up with the states that participated in cohort 1 of the CSLC. So we have some data on the slide here about their 6-month follow-up. So 6 months after the conclusion of cohort 1, we received a 70% response rate of the states that did not continue into cohort 2. And we found that 100% of the respondents indicated that they are sustaining their CSLC work beyond the scope of the CSLC. So we asked them about some supporting factors and some inhibiting factors. So what are the factors that are supporting you to continue sustaining your work beyond the CSLC, and what is stopping you from doing so? Under supporting factors, we saw that partnerships, specifically state and community leadership involvement and support, was very important, as was organizational capacity, having the adequate staff to complete their goals. And program adaptation, they found that they needed to adapt strategies as they were moving along and sustaining their work. Under inhibiting factors, we found that the lack of diverse or sustained funding was an inhibiting factor. So if folks indicated that they had some challenges, this was one of their challenges, as was organizational capacity. So we see that having the adequate staff is a supporting factor, and inadequate staff to complete goals is an inhibiting factor. Again, under program adaptation, when they were unable to adapt strategies as needed, this was an inhibiting factor. And communication also came up under inhibiting factors, when the lack of strategies to secure and maintain public support really inhibited them from continuing their work. But we are very happy to say that 100% of the folks who responded indicated that they are indeed sustaining their work beyond the CSLC. So here I'd like to share a case study with you of our Kentucky Suicide and Self-Harm Prevention team. And following the format of the rest of our slides, we'll be looking at how they're working in each of our inputs, each of our outputs, and hopefully getting to that ultimate outcome, that population level outcome in their work. So we'll be moving along, and in the beginning here, we have our inputs, which are child safety expertise, leadership and management, and systems improvement. So the Kentucky Suicide and Self-Harm Prevention Team has been working with on a zero suicide community of practice, and they're offering question, persuade, refer training, QPR, if you're familiar with it, for all pediatric hospital staff. So that goes under child safety expertise. Under leadership and management, they've solidified a main partnership and driver. They've institutionalized trainings and have obtained external funding. And I do see, because I was the one sharing the Mentimeter earlier, I do see that some additional folks have chimed in, and they've added a lot about people, about partnerships, about community partnerships, funding, consistency, and this is definitely under leadership and management with the Kentucky team. Under systems improvement, they've addressed gaps in screenings, protocols, and treatment, and we'll be talking a little bit more specifically about this as we go along. And they've developed a statewide coalition, so you can see that they're working within their team, and they're working beyond the team as well. So just to break this down a little bit more, I have some information here about what they're doing within their team, and then what's happening with the Suicide and Self-Harm Prevention Team in the CSLC. So under child safety expertise, they've accessed that evidence-based suicide and self-harm prevention strategies in the change package. So as everyone has mentioned before me, we offer these change packages that have evidence-based and evidence-informed strategies. They also have access to other state teams that have already implemented zero suicide statewide. They've already offered QPR gatekeeper training. So in addition to having access to the expertise, they're also learning from other states on how they implemented these programs, these evidence-based strategies in their work. For the internal team, they're participating in a zero suicide community of practice and included QPR discussions and the child and adolescent perspective in their statewide coalition. And they trained all staff on QPR to become trainers. So they're not just promoting the programming, but they're also participating in the programming themselves and contributing directly to the statewide knowledge of it. Under leadership and management, one of the key pieces that we see here is the solidified partnership with their main partner driver of the work, which is UK Healthcare. And we will hear from Dr. Christina Howard during our discussion session on how that works. Their team itself is co-chaired between the Kentucky Department of Health and UK Healthcare, and they participate in their statewide coalition. Under the internal team, they built buy-in from key contacts and partners. They provided training for team members to become trainers themselves. And there's participation in the zero suicide community of practice that's statewide, and they institutionalize trainings for new hires. So we start to see all of these other pieces of how this is fitting in and how this is becoming a part of the way that they do work and not just a one-off intervention. So under systems improvement, and you'll see some of the items here have already been included in the other two sections. And that's because some of the activities that folks are doing within the CSLC might fall under each of these, under multiple buckets or slices of the pie. So in the team, they're participating in ongoing quality improvement with support from the CSLC. They're collecting and reporting data monthly to demonstrate this improvement. And then their internal team, they're addressing gaps in screenings, protocols, and treatments. They developed and are participating in their statewide coalition, and they've institutionalized trainings for staff and new hires. So again, we start to see where some items overlap, having that strong leadership and management is now influencing their systems improvement as well. For their outputs under workforce development, they've really institutionalized policies, procedures, and protocols for screening, through treatment, and follow-up of pediatric patients. They've trained all pediatric hospital staff, and they've institutionalized those trainings for new staff. So anyone coming into the system, into the UK healthcare system, is also receiving this training. Under child safety system development, they did develop their statewide coalition. They're recruiting more hospital systems and they're monitoring key data for metrics for progress and further improvements. So now we will go ahead and have a discussion and Q&A. So you can please go ahead and put your questions in the Q&A box at the bottom of your screen, and we can go ahead and ask some questions of you all. If the other co-managers would like to join us as well. Thank you, Dr. Howard and Beth Ostrich. Beth is our moderator today. She's a member of the CSNA, but she's also a member of the CSLC with the North Dakota team. So we would love to hear from your experience, how the CSLC has helped support your sustainability and support your work and sustaining your work.
I'm going to say I can talk while we're waiting on any additional questions if you'd like. So I'm Christina Howard. I'm actually a child abuse pediatrician, which is probably some people think is kind of weird, but I really started working with the Department of Public Health just because of child fatality reviews and seeing a lot of deaths by suicide in younger and younger children. So that really started our relationship and my conversations with the Department of Public Health and the discussions on suicide prevention. I think that so much like the healthcare systems and the health departments don't always talk very well, or they hadn't historically in our state. And so this kind of provided that opportunity to start to bring both worlds together. And I honestly, when we first came in, and it was the health department that suggested us start CSLC again. And when I first came in, I had no clue much about CSLC. Started looking at the change package, and I think the change package is honestly is one of the biggest strengths of being a CSLC partner. And our health department, our behavioral health expert on suicide was like, you guys, we should do zero suicide. We are seeing other institutions doing this, and it's making a huge impact. And so that was what we chose for our first implementation of a program. And Maria, I don't know if you remember some of these conversations, but initially I started going down all these rabbit holes. I was like, I have no idea what zero suicide is. Like, it's a huge framework and a huge task to take on. And so one of the measured outcomes was the number of institutions implementing zero suicide. And so that we kind of got to a point, we had a training in the state where we had all community mental health centers and then 2 healthcare systems. And then I felt like we got to that point, and then I felt stagnant with our measurable outcomes. I was like, Maria, we have this many going, but there's no other input to give you. Like, it's just, we haven't started, but it's such a large framework that it's a lot of work that goes into it. And she was like, well, so what are you doing within it? And I was like, oh, we picked the first easiest thing was to do trainings. Because that would cost the least amount, right? We could start to do trainings. We had some things in place, and she was like, well, you're doing training, so that is actually a measurable outcome that you can use as well. And so with that was like, oh, okay. We went from, that's when we chose the QPR. We had funding from our behavioral health program to do train the trainer. And so that's when we had trainers within our institution to do the training. And we trained 600 people within 6 months in the Department of Pediatrics. And so that's kind of, it started to get disheartening when I felt like we were stagnant, but then having that technical conversation with Maria was like, you're just not measuring now the work that you're doing internally to zero suicide. So that's where we did that. For sustainability, I think that having multiple sources of support helps. When I was asked, kind of one of the best pieces of advice when starting something is getting that leadership support is huge, because there's going to be some upfront support that's required. And Maria and Lauren, you guys stop me if I need to stop. And so, I think having that leadership support to implement changes was huge. And so the Department of Pediatrics was fully supportive of all the work that we did. our leadership team was like, yes, we need to require everybody to have QPR training. So that statement right there really helped to drive a lot of our trainings that were happening. And then once we saw that, we started to get feedback from those trainings about how it was helpful to have that in person so that we could hear the feedback from the providers. We love to do, like, we want to identify these, but we don't know what to do once it's identified. We don't feel confident in our ability to take a positive screen and what we should do with it. And so taking that feedback kind of continued to lead us down pathways where we've gotten grant funding, we've gotten a lot of donor support that helps this, and then also looking at fee-for-service models to help support some of the mental health services that we're providing. So that's where we start to look at, you know, what are our numbers like? What can we get from this source versus what do we have to supplement in order to sustain this program and prove the importance of these types of services. I'll stop
Great.
there.
Thank you so much, Dr. Howard. Beth, do you have anything that you'd like to add about this experience?
Yeah, I think this experience has been really good for us. And I'm just I'm from North Dakota and working on the SUID component of the CSLC. And I think for us, really getting us the change package and a structure, we were doing a lot of different kinds of work, but not really documenting it or putting it anywhere or necessarily tracking everything. So when that change package and this opportunity came up, it really gave us a component to streamline our work, but also encourage me, because I'm kind of a one-man team, encourage me to branch out and look at what are the other areas in the state doing. And that's how we then built our cohort. And using the tools that you guys provided us really helped us fill those gaps. Asking us like, well, who do you have for data? Who do you have working at the local level? And pulling everybody in has really helped us sustain our cohort because, like you mentioned in your presentation, building off each other's strengths has been really helpful. And our goal will now be to sustain it through the different changes with the federal funding and different opportunities available in our state. And so I think that it's just been a really good experience and helped us streamline our work. And it's good to be able to show our leadership, like, look at these numbers, like, look at what we're doing with these change package measures and showing them that we really are growing and making a change within our state.
Great, thank you so much. So I'm hearing from both of you that there's this component of partnership, having to partner with other folks, building up a story and being able to tell that story to either garner more partnerships, additional funding, go beyond what you're currently doing. I'm hearing some more pieces of leadership support and institutionalizing some of these pieces, and also getting support from other states. Lauren, have I captured everything that both Dr. Howard and Beth have been sharing with us today?
Yeah, I mean, I think you have. I think there was one other thing I was thinking of, which is just, I think what Beth just said about, being able to share your successes with leadership is really important. I think a lot of what we do as we support the CSLC teams is to talk about, what kind of data do you have and how do you communicate that in a way that makes sense, in a way that will kind of make a case for what you're doing and why you want to continue doing it. So that's just one of the many pieces of technical assistance that we provide and some of the tools that we have.
Yeah, and I think one of the things that's been really important for me as a TA provider is to emphasize that sustainability is beyond just funding. And I think both of your statements just now exemplified that. You were talking about needing partnerships. You were talking about needing support from other folks in the field, needing the support of leadership, that it's not just the funding, it's also the documentation of, looking at your data, seeing what you're doing, being able to document your process so that no matter what happens, you're able to go back and see what has been done and how it worked within your state.
Yeah.
All right,
Oh,
I see. Oh, go
I was
ahead,
just going
Lauren.
to add one thing. I know I liked when Dr. Howard, when you started talking about kind of starting small and starting with something that was a pretty easy reach for you. And I feel like that's just a good example because people do join these cohorts really with any different, with many different kind of levels of experience and knowledge. I know that I've had teams that have started. I don't know much about bullying prevention in my state, so I'm going to start with actually just doing this landscape analysis so I can understand it well, so that I can then figure out what my change ideas are and what the strategies are that I might want to implement and how I can measure them. But you can start wherever in the process, and we're here to support you with that.
Yes, that was also where I think we felt stagnant was that data collection piece and where did we want to start. But I think the partnership with the health department is really what helped me bring that data to our institution to really get their buy-in for it. So I think that's what really helped. And we still continue to go back and forth in getting the data from the state in order to implement changes. And so I think that's all very important.
Wonderful. Thank you so much. We do have a question from an attendee that if they're new to the role, how do they know if their organization or department is part of a cohort? You can feel free to reach out to us at any time from our website, and we'll be able to connect you with your local folks. Great. So we have I would love to hear a little bit more about how you're developing you're developing and furthering partnerships. So Beth, you mentioned that you're a team of one. So but you're doing an extraordinary amount of work in North Dakota. So can you share a little bit more about how you're developing your partnerships and leveraging those partnerships for your work?
Yes, I can. So a team of one, meaning I'm the only injury prevention program director, but I do rely heavily on our child fatality manager, and then as well as our epidemiologists, all within HHS. So I'm not the only one working on this work within HHS, but we use all of our community partners and different organizations then to help us bring up and carry out the work. So we have some guidelines that we're working on. We really lean on the Children's Safety Network for our questions and definitely our TA. But yes, building up from just a one-person program and being able to expand it statewide, which was just huge. We've been able to increase our tribal partners, our new American partners, by pulling them into our cohort with us, which then gives those populations a voice as well. And that has really been impactful. We've been trying to reach some of these harder to reach populations for a long time. And building this cohort with the Children's Safety Network opportunity has given us kind of that bridge, right? That, like, look at this change package, and this is what we're trying to do. And so it's expanded that work from beyond myself to the others that are also passionate about suicide prevention within our state.
Wonderful. And oh, I'm sorry. I'm just making sure that we have we're answering all of the questions.
I can respond to the
Oh,
agriculture one. I've not heard of
go
Progressive
ahead.
Agriculture Safety Day. However, I do think that Kentucky's extension offices is a huge benefit of our state, how many we have and across the entire state. So we have partnered with them on some injury prevention. We hadn't suicide yet because we wanted that mental health, behavioral health person to be able to respond. But I do, so now that you bring that up, I'm wondering if QPR wouldn't be a good thought for some of our extension offices, people as well.
Yes,
Great,
and
thank you,
I
Dr.
can, oh,
Go
sorry.
ahead.
I can also just talk. We've really been working with our NDSU extension officer to pull up the agriculture safety component within our North Dakota Injury Prevention Coalition. But it's a good reminder that perhaps I should be reaching out to her also and pulling her into our SUID cohort work. We do partner with them throughout the state and a lot of our injury prevention initiatives, but not for in my case, not so much for the sudden unexpected infant death. But it is a really good idea because we know that SUID deaths can happen to anybody. So it'll definitely
Well,
give me another to do.
Thank you. I just want to reiterate the question because I am not sure that folks can see it. Someone from our audience asked if anyone works with Progressive Agriculture Safety Day programs and that there's a strong presence in both Kentucky and North Dakota. So it sounds like we'll be making some connections. So thank you for this question. And that they especially have a presence with extension programming. And that they often say that they work in human sustainability, focusing on children ages 4 to 13 and wanting to keep the next generation safe. So thank you for this question, and we do appreciate your question. And there was a follow-up as well that they do have peer-reviewed mental wellness and stress management curriculum. So maybe that's something that we can look into. We do have another question about that there's lots of talk about what's going on within states, but what if an organization is across the United States? And I do think that there are some good connections that folks are making. There are a number of national organizations, including on our Child Safety Now Alliance, where we're able to share data with folks, really get some emerging issues that are coming up in child safety topics, and they can really they really help support us in driving our priorities forward, and supporting child safety across the country.
And just to add, and just to
go
add
ahead,
to
Lauren.
that, we do have lots of resources on our website. So depending on the topics that you're working on, there's a lot that we have available that might support your work. Also, for national organizations that have like a local presence, sometimes they do partner with like a Title V office or a partner of a partner of the Title V office that is working in one of our topics. So like there's definitely room to partner with organizations that are part of the CSLC if you have a local presence in one of the states that we're working with.
Thank you, Lauren. And that is a great reminder. We are talking about 2 of our 4 topics for the Child Safety Learning Collaborative, but our website does cover a wide range of topics for 0 to 19 years old. So please feel free to reach out to us for additional information. I want to thank both Beth and Dr. Howard for sharing their experience today and helping us think through a little bit more about how we're supporting sustainability within the CSLC. We are going to pass it back over to Jenny to talk to us a little bit about our next cohort.
Thank you so much, Maria, and thank you again, Dr. Howard and Beth, for sharing your experiences. It really it exemplifies the work we're trying to do. So as noted, we are also preparing to launch our final cohort in this funding period, cohort 3. It will begin in November of 2026. It's an 18-month cohort like our others have been. And as you heard from Lauren early on, it's an opportunity for new teams to establish, so new states can join. States that are already in the CSLC have an opportunity to expand and start a new topic area. And we have many states that will just continue on from cohort 1 or 2 into successive cohorts. We've had some teams with us now for 8 years that have been continuing to deepen and develop their injury prevention work through the CSLC and quality improvement. Our applications are pretty straightforward. They will go live on June 22nd. They'll be posted on the CSN website, and you can access them there. We will have several, and you'll see in a moment, several opportunities for you to come and learn more about the application, to understand more of the nitty-gritty of the CSLC and get all your questions answered. And then applications will close at the end of the summer, and we will provide acceptance and orientation for new teams in late September, and then getting you prepared to start joining the cohort in November. Next slide. So as noted, when we launch the application, we'll have several informational sessions. They're pretty much the same, so you're welcome to come to more of them than one, but multiple options available, and they will all have registration links posted on the CSLC portion of the CSN website. So you can access that and register and join us for an application information session, and then get more guidance if you're interested in applying. Furthermore, we are always available to answer any questions. Please reach out at any time. You can access us through contact information on the website, or submit a technical assistance request. I'm going to hand this back to Beth to finish us out for the event, and I thank everyone for joining us.
Yes, thank you. So I would like to thank all of the presenters and the audience for participating today. Please take the time to complete the evaluation of today's session, and I would just want everybody to have a great day.